Okay, and our next group is the Crimson Consultants. So please introduce yourselves and tell us about your product.
Good morning, everyone. So this is our company, Crimson Care, simple, reliable, dignified care. But first, I would like to present our board of directors. My name is David Mendez, and I go to Roosevelt High School in Chicago.
Hi, I'm Addison. I live in San Antonio, Texas, and I go to Alamo Heights High School, and I'm a junior.
Good morning. I'm Ashrit Ponna. I go to University High School located in Normal, Illinois.
I am Patricia Offram. I go to William Penn High School located in Powhatan, Illinois.
But before we start, I would like to share you about a few stories that we have.
So our first story is from Olua Damilola. She is 24 years old and she's from Kano State. She is 8 months pregnant with her second child. She had, with her first childbirth, she gave birth at home and an elderly neighbor helped her. She, which ended in her bleeding severely. And this time around, she wants to go to a clinic, but the closest clinic to her is 2 hours away. So she's trying to team up with us to find transportation for her birth. Then we have Ollie. He is a 52-year-old groundnut farmer. He has been feeling back pain and been seeing blood when he urines. And that has progressively gone worse and has turned into prostate cancer. And he hasn't been able to get proper care due to the expenses of the hospital bills. And then we have 7-year-old Ugochukwu, who is experiencing cough and high fever. At first, his parents passed it off as malaria, but it turns out it is pneumonia. And with us, he will be able to get his antibiotics and pay for his hospital.
Before we begin analysis, I would like you, investors, to take some time to imagine a world where you're born in a family that's experiencing severe poverty in a currently developing nation. Now, the main key idea you need to take away from this is there is 100% risk and uncertainty here because you really can't change your outcome as an infant or as an individual under 5 years old to seek access to clinical or hospital care. And that is the main and prevalent issue that we are trying to solve as Crimson Care in the region of Nigeria. For elaboration, approximately 83.4% of residents in Nigeria do not have access to healthcare whatsoever, and that equates to approximately 190 million individuals. And a positive from this is that mobile phones are actually growing exponentially in the region. Although they may not be smartphones, most of them are considered simple or dumb phones, which are powered by a software known as KaiOS. Now, this is beneficial for our corporation as we're able to partner with this operating software to implement an app that we'll later discuss further on. And a key point to note out is the average income that many individuals and residents in Nigeria on the outskirts of various towns is approximately $1.90. And a huge proportion of those individuals that are experiencing those low income come from our target and key perceived region known as the Kano State. Now, the main issues that we are trying to solve as a corporation is mortality. Mortality rates are prevalent in practically every country internationally and even domestically. The main key factor here is the global and regional differences in the proportion rates. For instance, the infant mortality rate in Nigeria alone was 0.0722%. And furthermore, on a global scale, it was 0.0274%, a near ×3 factor increase. Although this may seem minimal, when taking into account the global population of 8 billion, that equates to near millions of individuals that we are trying to save. Another key issue that we are also trying to solve is transportation. Several farmers that earn an income of $1.90 per day live on outskirts of towns with no plausible transportation to various different hospitals or clinics. With 0.5 acres averaged allowed to them, there is numerous sources of farmland separating farmers from key distinct hospitalized regions.
So this is the insurance company app. So first of all, you just have to download the app on your smartphone. Even if you don't have a smartphone, we have the company's phone number right here. Then log in and create your own account for free. Choose one out of 3 insurance options that we have, which are Crimson Plus, and Crimson Deluxe. And if you need it, schedule an appointment. And my colleague is gonna show you about the three different options that we have.
So to start,
Sorry for the delay, guys. Technical difficulties.
So in order to figure out what we wanted to charge people, the premium that we wanted to, we needed to figure out our overall loss first. So we multiplied the frequency by the severity of the amount of times people needed healthcare by how severe it was for them. So up here we have per tier, because we have 3 tiers that she's about to explain. And for each one, it shows the frequency and severity. And this is the total loss. So we needed to calculate that in to figure out what we wanted to price people that's logically and economically logical.
To further add on to this statement, we actually assumed and correlated computer science simulations. So a Monte Carlo method, which basically runs simulations numerous times, actually predicted those percentage rates that you'd see 8 cents, 15 cents, and near 16 cents. And those percent and premium rates that we've actually discovered by Monte Carlo simulations are actually the closest possible benefits that people in Nigeria could get in terms of the $1.90 average income they earn per day.
so here are 3 policies. We have Crimson, which it's 13 cents per week. It includes outpatient visits, which you're able to access once every 6 months. And we have emergency transportation, which also falls into our other policies. Unfortunately, for our starter pack, we do not have chronic care or childbirth coverage. For our Crimson Plus, it's 21 cents per week, and this includes chronic care, childbirth coverage, and child illness visits. And then we have Crimson Deluxe, which is 40 cents per week, and this includes emergency care such as surgeries and childbirth coverage. This also includes health education and private practice.
Now, depending on which one you choose, there's different co-payments. Although they are really low, we try to make it economically reasonable for people that we're focusing on rural areas. We have outpatient visits, childbirth, child illness visits, emergency care, private practice, and chronic care visits. Along with this, we have transport co-payment to go with the people that are in rural areas in order so that they can access our healthcare. We want this to be reliable and dependable for people who don't make as much so that they have an option. It's 3 cents per 13 miles. In Kano State, there's a total of 27 miles that people live within. So that means that there's a maximum of 6 cents that they could purchase for transport co-payment, keeping our cost low.
Now, we are aiming for a global impact that is nothing like you've investors ever seen. For instance, phone monopolization in the 2026 year alone is expected to increase by 65%, and this also includes the simple and dumb phones we mentioned earlier, running those KaiOS softwares. Furthermore, post-2029, in Nigeria alone, approximately 100 million plus individuals are expected to own a smartphone. And in regards to our KaiOS partner company, we expect them to sell 5.45 million units, which is heavy considering the population of Nigeria is 15 million, near a 30% proportionality rate. Furthermore, we're trying to save an estimated 7 million lives because these individuals near the Kano State region are not able to experience any sort of clinical care whatsoever, leaving diseases undetected and undiagnosed for long times, lowering severity and risk rates overall. And furthermore, we're trying to raise public awareness so that our policies can be implemented throughout Nigeria instead of the target Kano State region, so that numerous other people, approximately 100,000 children annually, can be saved.
In order for us to make sure that our plan is reliable, we wanted to start off with a launch plan. We had an idea to start off by sending it to allowing it for the access to 10,000 people. This would be our testing phase. Our revenue should be about $68,281 US annually, and it's estimated to cost about $35,100 annually as well. This will help us build trust with different communities and different things that we need in order to grow our company. We're going to have transport providers in order to provide the transport that we need with rental car services so that we are sustainable and reusable with these cars. We also want to develop relationships with community leaders and build trust with local communities like the World Health Organization. It'll also allow us to collect real data and feedback from the people that will be using our product and use the real data on claims, usage, and patient feedback. This will also help us test and redefine our tiered practices that we talked about earlier, and the co-payments and transport vouchers.
So these are our partners. So with these organizations, this allows us the resources to transport our clients and team up with local clinics to ensure that our system is working effectively.
So invest for a new future, globalized healthcare. Thank you for your audience, and I hope you enjoy. We are open to questions. Thank you.
Very good. So let me stop sharing so we can get some audience participation here. Okay. Any thoughts, comments, questions?
Yeah. Can you hear me?
Yeah.
We can.
This is a super impressive presentation. Yeah, I was amazed by you did so many things. You have a very innovative solution. The distribute insurance through the mobile phone. And I want to talk about that. It's a great idea. It can lower insurance cost significantly. And given that the state, the area, the city is relatively underdeveloped. But the good thing is that many people have a phone, and the distributing insurance through phone can significantly lower the underwriting cost and the many other insurance, administrative cost of insurance, issuing insurance. It's really a great idea. Actually, I want to talk about that in China. There is a very famous digital health insurance. It's also distributed through smartphone, has been very successful. They have the first generation, it's called Hu Hui Bao, version 1, and also second generation. I changed the name a little bit. There has been a lot of research study the the virtues of this digital insurance. It's been a great success in China. I think it's a promising solution for micro insurance, especially in developing or underdeveloped countries. Also, I see the Monte Carlo simulation. I see you have 3 different layers of insurance plans. And even have a launch plan, a trial plan. These are all very impressive. Yeah, I see you have input a lot of work and the creative ideas and a lot of research in this in this project. Yeah, very good.
That's what they can go.
Congratulations.
Yeah.
Thank you.
Yeah. So I know Michael or Simi's in Nigeria, and it's like I don't know if one of you have comments about this.
Yeah, I'm going to just speak a little. Yeah, I do live in Nigeria, and I think this is a very impressive presentation. I think you've done an excellent job of like articulating the problems that are being faced in these areas. These are very real problems. These are very prevalent problems as well. I love the quantitative approach that you've taken to like solving the problem. I love the fact that you've considered like different ways of distribution, because that's a very big thing in microinsurance, is ensuring that your distribution channels are accessible to your clients. I love the fact that we're considering, making use of USSD and making use of like mobile phones to ensure that the products are reaching the clients. Yeah, I'm very impressed with this presentation, and I think this is great. Well done.
Thank you.
All right. Okay. All right. Thank you. And we'll move to our next presentation.
Thank you.
Let's see who we have for the Raiders. Oh, okay. All right. So which one are you guys?